My name is Tony Capo, and my company Opticology is the innovator, and the New York Eye and Ear Infirmary is the host for this pilot application. Over 17 million Americans suffer from type 2 diabetes, with a projected annual growth rate of 18%. Our technology provides a means for diabetics to measure their blood sugar without having to prick their finger and draw blood. I'm an optical engineer, and I design and build classical instruments like telescopes or more modern devices that use lasers for industry, communications, or medicine. The reason I'm in this hospital is that part of my job is to design and build medical devices that are in the early stages of development. My company Opticology has been in business for over 14 years in the same location in Manhattan's Chelsea section that houses our offices, laboratory, and workshop. The New York Eye and Ear Infirmary was founded in 1820 as the first specialty hospital in America. It is one of the largest providers of eye care in America, performing over 30,000 surgical procedures a year and seeing over 200,000 patients. Unfortunately, many of the patients seen here at the infirmary are diabetic and suffer from diabetic eye disease, the leading cause of blindness in American adults. Type 2 diabetics, those patients who do not inject insulin, should check their blood sugar at least twice a day to lead healthy lives. Type 2 diabetes could easily be considered a raging epidemic in this country and around the world. So why, of the 17 million type 2 diabetics, do a good percentage refuse to test their blood sugar one or more times a day? Because it is painful, it's inconvenient, it requires self-sticking with a sharp needle on your fingertip, which bleeds a lot and hurts a lot. You need a supply of needles, test strips, and a small machine. You should do it throughout the day, when you wake up, at work, when you're out with friends, in the evening. It's no wonder. We've developed a better way to measure blood sugar, through ocular tears. It is well known that glucose shows up not only in the blood, but also in tears. Our invention is an optical-based device in the shape of a pen that measures the concentrations of constituents in the tear film. This device contains a small laser, a camera, and miniature lenses to direct light to this sensor tip. The tip of this sensor has a very thin film of metal to which we adhere chemistry that exclusively binds with glucose. Place this sensor in the tip of our pen, turn it on, and touch the tears just above the lower eyelid. That's all that's needed to measure blood glucose. Throw the sensor tip away and insert a fresh one next time. We have completed laboratory testing, developed the instrument, fabricated the sensor, and have enlisted Columbia University to help with the chemistry. We are ready now to run our first clinical trial on a number of patients at the New York Eye and Ear. With your help, we can show the world a better way to test for glucose that is painless and convenient. Thank you for your consideration.